If you're getting ready for your gestational diabetes screening like I am, I want to share what your options are because you have options with everything throughout your pregnancy to include the gestational diabetes test. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. So this will be my 4th gestational diabetes screening. And I want to share what I've used during my pregnancies and what your options are when it comes to this test during your pregnancy.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife. And I have also taken 3 gestational diabetes tests myself during my pregnancies, but also help educate my patients on what is this test.
So Roxanne, what is the gestational diabetes screening? Like, what can we expect? What time frame do we typically have this test?
So the gestational diabetes screening is done between 24 and 28 weeks of pregnancy. And this is due to wanting to screen for something called gestational diabetes that can develop during pregnancy. And this is insulin resistance. So your body is not able to utilize its insulin that it has in its body as efficiently. And this can be an issue. Gestational diabetes reaches its peak where we're able to actually identify it in most people in the end of the second trimester, which is why the gestational diabetes screening is done in that 24 to 28 week window. It is important that the one that most people are going to do is a screening. So they most likely are not going to diagnose you with gestational diabetes if you fail. So if you do not pass the gestational diabetes screening, it does not mean that you have gestational diabetes unless your number is crazy high, then that is an indicator of oh yeah, you have gestational diabetes. But for most of us, if you do not pass it, you then go on to do the actual diagnostic test, which actually will tell you whether or not you have gestational diabetes or not. So if you fail your gestational diabetes test, like the screening, it's not necessarily that you actually have it, but you do have to take another test. So the gestational diabetes screening is where you drink a drink, you come in, drink this drink, you have to drink it within 5 minutes, and then they're going to check your blood sugar 1 hour after taking that test. Some clinics will give you the drink to drink at home, and then when you get to the clinic, then they'll draw your lab so then you don't have to wait there for an hour. Other clinics, you'll have to drink the drink there and then wait there for an hour to get your blood drawn. You do not need to adjust the way that you're eating prior to the test because we want a true representation of what your blood sugars are throughout the day. And if you did consume a large amount of sugar, what does your blood sugar end up with? Some people will say you need to fast prior to it. So don't eat anything before you take your gestational diabetes screening, or try to eat a low carb diet before you take the screening. This doesn't give a true representation. It actually could lead to either a false negative or a false positive, and maybe you actually do have gestational diabetes or you actually don't have gestational diabetes, and it leads to you having to take more tests. And in the clinic, most of the time for that 1 hour draw, it will be an actual blood draw where they're collecting blood in a tube and then they send that off to get that glucose number. Some clinics may just do a finger prick. So they'll tell you your blood sugar with just a finger prick, but a lot of clinics do the full blood draw.
The common drink that you'll be given for your glucose screening is the glucola drink, which is 50 grams of glucose. And it usually tastes like a flat soda. There's a few different flavor options depending on what's available in your clinic. There's grape, orange, and then I think unflavored.
Which, gross.
Yeah.
There's a lime too.
Maybe this lime. I remember having the orange one during my first and second birth, and it just tasted like a flat soda.
I've had the orange and the lime one, and I prefer the orange, but the lime's not bad. But yeah, it's just flat Fanta.
With a glucola drink, what most folks are reporting after they drink it is they feel really jittery or nauseous, or they just feel really uncomfortable in their bodies. And this is because you just drank 50 grams of glucose. That's a lot of sugar that you just took in. But it's a one-time drink that you do to help with this screening. It's important to note that glucola has been well-researched and is a safe option for you during your pregnancy. But if you do want to explore other options, because again, all of us have different preferences on what we want to intake within our body. Some folks don't like that the glucola drink has dyes in it or preservatives. Not all of them do, but some of them do. There are other options available to you. One of them that you can do instead is the fresh test. The fresh test has been FDA approved for glucose screening as well, and also has 50 grams of glucose. And it comes in this like mint lemonade flavor where it's pre-mixed, or you can get it in the powdered version where you mix it yourself. Some clinics will even offer it for you. Our clinic offered it for like an additional $15, or you can purchase it yourself. But it is approved by the FDA for glucose screening. I used the fresh test during my last pregnancy, and I found that I didn't have that same like jittery feeling afterwards. I thought the taste was a lot better. And some folks like it because there's no dyes, there's no preservatives in it, and so they feel better about drinking it during their pregnancy.
With my first 2 pregnancies, I just did the glucola drink. I worked in the hospital, so I just literally went down in the middle of workday, down to the lab, drank my glucola, and then went back an hour later and got it redrawn. So it was very convenient for me, and they did not offer the fresh test at that hospital. And a lot of people said that they tried to bring it in. One person tried to bring it in, and like the lab wouldn't allow it. So asking these questions can be really helpful to be able to be like, maybe I'll go to a different lab that will accept the fresh test if that's what you want to explore. But I did the fresh test with my most recent pregnancy, the powdered form. And on the back, it actually has like the directions of how to mix it to make sure that you are doing it right. Because you don't want to mix it with too little water, because that would make it like not taste great and also a lot harder to drink, I think. But you also don't want to mix it with too much water, because you want to have to drink it within 5 minutes, but also that could affect how much like of the glucose your body is absorbing and could almost dilute your blood sugar response potentially if you have too much fluid. So it comes with the directions of how to mix it. And I also felt the same with Gina, where I didn't feel like really as jittery with it, because I don't know why, but I didn't feel like as bad after drinking the fresh test than I did with the glucose. I felt really bad after the glucola drink with my first 2 pregnancies, where I was like very nauseous and just felt like out of my body, and like my face was tingling, and I just didn't enjoy it. And I did not have that same response that I did with the fresh test, which you think it would be similar because it's the same amount of glucose, but I just felt a lot better after the fresh test than I did with the glucola.
So you can definitely ask your provider in your clinic to see if they offer the fresh test for you, if that's something that you want to explore, or find out if you can purchase it on your own and then use it for your glucose screening instead of using the glucola drink.
Some other alternatives other than the fresh test and the glucola drink that you can utilize is some clinics will like have another type of beverage that has 30 grams of glucose in it, and that could be approved in your specific clinic. So I think some people use like grape juice in some clinics. Those ones are not researched to be as beneficial and actually accurate as the glucose in fresh test, but it potentially may be accepted at your clinic. Another option that you can utilize is to check your own blood sugars at home, whether or not this is with like some of those like continuous monitors that you can have. I think some providers have allowed like a continuous glucose monitor where you wear it for like 2 weeks to see like how your body responds to different meals, or you can just do finger sticks before and after certain meals throughout the day. The length of time kind of depends on the provider. The longest I've seen is 2 weeks, which I think is a little bit long. Most people do like a couple days, like 5 days is the most average that I've seen, where you like just eat your normal meals and take your blood sugars to see like your response with the meals that you're actually eating throughout the day. And this is another way to screen, because if you again have those high blood sugars after eating like a regular meal, this could be a sign that you do have gestational diabetes and maybe need some either nutritional counseling or medication.
So with the glucose screening, you do have options. And if you want to explore different options, definitely have the conversation with your provider before your 20-week appointment. And so for me, when I was around 20 weeks is when my provider brought up the glucose screening to me and started discussing what my options were. But sometimes you have to be the one that brings up the conversation with wanting to explore your options. Your clinic may only offer the glucola drink. They may also offer the fresh test or give you the option to bring it yourself to be able to utilize for the test if you want to do that instead of the glucola drink. And then again, you also have the option to just test your blood sugars on your own for a set period of time and kind of log what your methods were as well. So it's important to note that you have options throughout your pregnancy and throughout your birth, but if you don't know what your options are, you don't have any. So hopefully this video helped to explain what your different options are for the gestational diabetes screening, and let us know in the comments below what you utilize for your screening and what you found to be really beneficial about it. Do you wish that you knew about these other options? Because we would love to learn more from you as well. If you want more support throughout your pregnancy, check out our online prenatal fitness programs. Exercising throughout your pregnancy is something that could help to reduce your risk of developing prenatal complications like gestational diabetes. The more muscle mass that you have, the higher insulin sensitivity is, and so it could help to reduce your risk of developing gestational diabetes. Our prenatal fitness programs are offered in two formats. We have an app-based program, which is a list of exercise with demo videos, which is self-paced workouts. So if you like to work out on your own, this would be a great option for you. We also have our prenatal on-demand programs, which are full-length workout videos that you follow and work out with at the same time. So if you prefer to watch a video and work out, this can be a really great option for you.
And if you're looking for a childbirth education course to help prepare for labor and birth, check out our online childbirth education course where we discuss the science of labor and birth to take away some of that mystery. We'll also discuss birth options within the course so that you can understand what your options are and start creating that communication with your provider to see what options are even available at your birth location and what options you would actually want to utilize in your birth. You can check out both of these offerings and also postpartum offerings on our website at momstayfit.com. And as a thank you for watching this entire video, you can use code YouTube10 to get 10% off any of our offerings. You can also bundle a lot of these together with like prenatal fitness and childbirth education, as well as postpartum fitness and postpartum education to save a little bit more.
If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos, and comment below to let us know what you utilize during your gestational diabetes screening.